The crisis has become so widespread.
The powerful opioid that has
The number of deaths involving cocaine and fentanyl.
Fentanyl drove a 74% increase in...
I almost killed my kids.
In 2015, the opioid-related deaths in Wayne County totaled just a little over 500. The very next year, 2016, the numbers had gone to 817. And that's just the lives that are lost. Doesn't count the lives that are hurt. You know, we have to take some definitive action to deal with this.
The lowness of it is this: it's immeasurable guilt and shame. It is just a gut-wrenching feeling in your stomach, in your mind, in your brain, in your heart. An overwhelming feeling of just uselessness, just self-disgust. Oh, it's dark. It's so dark. The stigma is horrible. Society in itself looks upon addicts and alcoholics as low-life people in a sense. Not everybody, but quite a bit of them. All of our coaches have walked the path of the people that we're serving. So they have all experienced exactly what those individuals are experiencing. They understand when we walk in and we explain who we are and what we do, that we have walked in their shoes. And they understand that they can trust us and that we're there to help them because we've experienced exactly what they're experiencing at one point in our life. Rescue Recovery is what we've named our program at GrowthWorks. Basically going in, helping to rescue someone from active addiction and help them get into long-term recovery, hence Rescue Recovery. We're able to go into the hospital anytime that a patient wants to see a recovery coach and see them in the ER, see them in the behavioral health unit, see them in the chemical dependency unit. If they don't want to be contacted while they're in the hospital, they sign a release that says, have a coach contact me when I leave. What we do there is we blow their phone up for 10 days straight after their discharge from the hospital. See, we work off a moment of clarity when someone comes back from that overdose or somebody's in active addiction and they finally say, I need help. We strike at that point. So where I go back to the 10-day call log is that we blow their phone up for 10 days hoping to get another moment of clarity. Sometimes they just answer the phone because they're angry, but we're still able to get through to them and offer our services to them. That is extremely successful as well, which moves us to now connecting them in the community. A person with active addiction can go into the police department and say, I need help. The police department will contact us. We'll have a coach there 24/7, 365, the same as we do in the hospital, and get them connected into services, whether it be if they need to go to a residential facility, if they need to go to detox, if they need to get into clinical services. Then we move on to a really exciting piece, and that's with Wayne County Healthy Communities. Amazing. We're able to bring the clients that are discharged out of St. Mary's Hospital or that we deal with the police departments, or even in GrowthWorks intensive outpatient with domicile, meaning housing program. We're able to get them in here to the Wayne County Healthy Communities, set them up for their Vivitrol shots, which is an opioid blocker that helps them to move forward in their recovery, attacking cravings. And then we're able to connect them with health care, with primary care doctors, with dental work. If they have children, we're able to connect them with their pediatric care. It's absolutely incredible. The whole process is just amazing. Thank you, the state of Michigan. Thank you, Laura Cox. Thank you, Wayne County Healthy Communities, GrowthWorks, St. Mary's, the police departments. On top of that, we're able to connect with local communities that are possibly at high risk. Churches, community organizations, community groups that need help with education on substance use disorder. I'll tell you, through my 2 DUIs in active addiction and assaulting a Canton police officer in a 15-hour blackout from alcohol, Vicodin, and Adderall, I was connected through my probation officer to GrowthWorks, which I can say my probation officer to this day is my friend, which is powerful in itself. GrowthWorks saw something in me and took a chance. Through that, I have grown with the organization, which I give credit to and thanks for being in recovery as long as I have through my 1,675 days of recovery today. GrowthWorks plays an important part of that. They support me in every way. Our clinicians are amazing. I've had a lot of clinicians in my life, but I can honestly say, without bias, that we have some of the most amazing clinicians in any agency that I've ever dealt with. I draw power from my coaches. I draw power from the agency that I work with, the faith that they have in me. I draw power from my own personal recovery. I work a strong, rigorous recovery program, and I have to do that. I understand that I'm an addict and an alcoholic for the rest of my life, but I don't have to live in active addiction. And it's because of the people I work with, I work for, and the population that I serve that keeps me sober every single day.